progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Revision spine surgery is surgery performed in certain patients to correct the problems of earlier spine surgery. Revision surgery may be indicated in patients with chronic pain even after surgery. A dedicated team of surgeons, nurses, and skilled therapists at Palmdale Regional treat patients by using advanced technology, including nanotechnology. Welcome to the show, Dr. Parsa. So what is revision spine surgery and when would it be needed?
Hi, Melanie. Well, revision spine surgery is exactly as the title says, for individuals who've had surgery before and did not obtain the benefit of the surgery the first round of having the surgery. So, as an example, if you have neck pain radiating into your arms and you have a neck surgery, then and you wake up and a couple of months pass and you still have neck pain and you still have arm pain, then those are the scenarios where at least nowadays we can go back in and revise the surgery and help bring back functions they had that they wanted to gain from the first surgery. That's one way of looking at revision surgery. Another way is for surgeries that were done well, but now other areas of the spine above or below the prior surgical site have broken down, or if someone gets in a car accident or has a bad fall and breaks what was done the first time around, and now the pain has come back. So these are essentially the indications or scenarios we see in revision spine surgery.
So, Dr. Parsa, it would seem in revision surgery, is it uncomfortable for patients to ask you about fixing something that another doctor did?
It's not. I think some do. So I've had some patients who are slightly uncomfortable. They feel they're betraying a former physician or whatnot. I generally don't think that should be of a concern. I believe all physicians are doing their best in trying to help their patients, and some just don't have, some other physicians don't have the training or haven't been exposed to some things that others have. So, and it's the same, I'm sure, possibly even for me as well. There are scenarios where, if I haven't been able to help a patient, and I would be happy for that patient to go to somebody who can help them. So, I see how the patients view maybe that they're uncomfortable, but I don't think the physicians don't look at it that way. We all just want to help the patient get better. And if we can't do it, I would be more than happy, or whomever in the community would be more than happy to have someone else who can take care of it.
So tell us about some of the procedures intended to repair previous interventions. What kinds of procedures are we talking about?
A common one is fusion surgeries, especially with the older technologies. Fusion didn't take or didn't occur. So usually we say that, I'll give you an example. So if you have neck, let's say C4-5 neck surgery, one-level neck surgery, and the idea was to fuse it. You place a cage in the middle, you take the disc out, you place a cage, take the pressure off all the nerves, and place screws and plates. So the idea behind that fusion surgery is that the bone will grow from the C4 to the C5, and it will all become one block of bone within a year. And if that occurs, you don't really need the screws and plates anymore. The way the screws and plates are designed is to hold everything together, fixated for a year and a half. So if that fusion doesn't occur, then you're at risk of a failed surgery or fusion surgery called pseudoarthrosis, where the fusion hasn't taken, and you can potentially have recurrent or worsening neck pain is a very common scenario, and sometimes arm pain, but usually neck pain or mechanical pain is a very common presenting symptom. So that's a very, very common one. Another scenario would be, let's say you had a C4-5, staying along the same tracks, the C4-5 fusion surgery, and it goes great, and you do fuse. But now there's more stress on the levels above or below that level at the C3-4 or the C5-6 level, and now those have broken down, and you need to go back, revise, and fix, essentially fixing a new level below it. So that's two common scenarios. A less common scenario is if someone gets into a car accident or falls and breaks the instrumentation or the healing process that was trying to take after the first surgery, and now needs the revision surgery to fix that.
So you're using a new fascinating bit of technology called nanotechnology, and specifically the Titan Nano lock in revision spinal surgery. Explain what this is and how the textured surface impacts that fusion process, because I think this is absolutely fascinating for listeners.
Yes, it is. It's a great technology. It's essentially in the past what we used to use for cages were plastic in reality, and the surface technology was non-existent. It just had some ragged edges so that it doesn't slip out. Then the Titan company essentially started doing clinical, first laboratory research and then later progressed to clinical research to help advance the surface technology to match the osteoblast cells that are trying to form bone. And if they found out that if they have the correct size and angles to their to the surface, they can promote the fusion of the bone onto the cage. So that was their major breakthrough. And by using titanium instead of plastic, that also helps helps incorporate with the bone better than plastic. It doesn't form what we call biofilm or a film that stops the fusion process essentially. And by using those two together, they've really enhanced recovery rate, not only for spine, for revision surgery, but even for first-time surgeries and for recovery and healing.
Because our bones are not smooth like a piece of plastic, right? They've got little bumps, they're porous, so when you're talking, and so that the listeners understand this, when these bones have to form and you talk about the cages and that adherence to whatever material you're using to do this revision spine surgery, is this a cellular thing? Do our bones naturally adhere to surfaces? Or explain a little bit about the physiology of it.
Absolutely good question. So that's exactly where Titan did their research, is at the cellular level. They found that no, bone doesn't adhere to anything by itself. It likes to go to itself, to another bone, but it doesn't like to adhere to other material unless they have the correct environment. So they found out that by using different specific angles of pores. The nanotechnology is actually their second generation. What they did is they used the research to find the right angles and the different depths from nano scale to micro scale to help the podocytes from the osteoblastic cells basically capture or stick onto the surface of the cage. What I mean by nano is 10 to the power of -9. Obviously, it's not visible to the naked eye. So these are really, really, really small porous structures that help the cells stick to the surface of the cage.
Wow, that's absolutely fascinating. So, in summary, kind of wrap it up with your best advice for listeners about revision spine surgery, when that might be indicated, and what should they think about when seeking a physician to do revision spine surgery?
So, first of all surgery, the most important thing is if you're going to have a spine surgery the first time around and you don't improve from the surgery, then generally that means you need a revision. And yes, you can get better. I have had a lot of patients come to me who are afraid of surgery because they've heard of a lot of failure rates and people never improving. So it's always, if you're not better from your first surgery, then you always essentially need an evaluation to see what's wrong. Why are you not better? That's the most important thing. And whenever you're going into thinking of a second surgery, I think it's very, very important to have multiple opinions. You've been through this one, so if you're going to go back to your same surgeon, great, wonderful, but also keep in mind, see other surgeons as well. I always recommend at least 2, preferably 3 surgeons. And the type of surgeons I would recommend are generally board-certified surgeons who are fellowship-trained in revision surgeries, deformity surgeries, so more complex, because everyone doesn't do the same, hasn't had the same training. So these are the second opinions I would generally recommend to go and seek to get the right care.
And why should they come to Palmdale Regional Medical Center for their care?
I think Palmdale is a great asset to the community. They're new. They have wonderful staff. They're clean. All my patients essentially have been very, very happy with their care. The nursing has been superb. They have a specific unit for spine and brain surgeries where the nurses are specifically trained in that field to help adhere to their needs, the patient's needs. So I think that these are all benefits that individuals will get that they won't potentially at smaller or different community hospitals. I'm very happy with them from a surgeon aspect, and that they have very good equipment. They allow me to use Titan and different products that I feel are best for my patient. Their ORs, as I said, are very, very clean. Infection rates are low, extremely low, and it's just a comfortable, pleasant experience for both surgeon and patient.
Thank you so much, Dr. Parsa, for such a fascinating segment. It's such great information. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Individual results may vary. There are risks associated with any surgical procedure. Speak with your physician about these risks to find out if minimally invasive surgery is right for you. This is Melanie Cole. Thanks so much for listening.